Welcome to our weekly broadcast of the African Treasures. Here we bring to you African arts, culture, and music. We also discuss issues of concern to people of the African descent in America, the Caribbean, South America, Africa, and all over the world. We invite you to come and see Africa in a positive light. So stay tuned and tell your friends to do the same.
Welcome to African Treasures. I'm Dr. Mike Okeke, your host. Are you concerned about unwanted hair growth on your face, legs, and other areas of your body? What about facial wrinkles, acne scars, blue spider veins in your legs, shaving balms? Well, cosmetic laser treatment may be the answer. And Maria Walker, MD, is my special guest today to help us in this topic. She's the medical director of the Piedmont Minor Emergency Medical Clinic. Welcome to the show.
Thank you, Dr. Okeke.
Well, Dr. Walker, how long have you been in practice?
24 years, Dr.
24
Okeke.
years. Dr. Walker, you don't look it.
Thank you, Dr. Okeke.
Did you start as a teenager?
Yes, I did. No, not exactly.
I understand your practice has 3 areas of concentration.
Well, I'm a board-certified internal medicine specialist here, so my primary practice in the Atlanta area has always been internal medicine, taking care of the whole patient.
Yeah.
This is a more recent addition to my treatment of patients.
So I think I'm referring to the Piedmont Minor Emergency Clinic, the Piedmont Travel Clinic, and the Piedmont Cosmetic Laser Clinic.
That's correct.
So these are the 3 different arms of your practice.
That's correct.
Yeah. I would really like us to focus on the cosmetic laser treatment as it relates to people of the African descent.
Yes.
Because this is African Treasures, and our target is people of African descent. What is it? When do you apply the cosmetic laser treatment? What is it used for?
Well, laser is a form of light energy that can be used to modify body tissues.
Okay.
The earliest lasers that were used for cosmetic treatment or skin treatments were at a wavelength that were primarily thought of to be used on Caucasian skin, especially. Okay. So it wasn't traditionally used on skin of darker skin colors. Mm-hmm. But the more recent lasers that are available now can be used on darker skin, African skin, or African American skin colors. So this is something fairly exciting for us to be able to use these type of treatments on people of color.
Is there a new development in technology that allows it to be applied to people of African descent?
That is correct.
Okay. Do you mind breaking it down? Tell us what the difference was, or what the difference is now.
Laser comes in several different wavelengths of light energy.
Okay.
So the earlier lasers were of a wavelength that was a little bit harsh on African American skin. And our skin traditionally scars more, takes on dark spots as we heal. That's part of our natural healing process. Okay. That wasn't necessarily true on Caucasian or lighter skin tones. Okay. But the wavelengths that are used now don't have that same type of scarring. So it's more available for people of color.
What we're talking about here is sometimes you see ladies with facial hair, and some of them use heavy makeup to disguise it. So you're saying that there's hope for people like that now?
Absolutely.
Okay, and this laser treatment helps to do what to the hair? Just remove it or treat it or what?
Officially it's called permanent hair reduction. People also will always ask, well, do I just have to do this once and then I'm finished with it forever?
That's what I was thinking.
Hair is growing constantly. Our bodies are changing constantly. Okay. So even though the laser will make the hair thinner and more sparse. Each successive treatment, it becomes more and more sparse. So ultimately, over a period of time, there may not be any recurrence of the hair. But we don't tell patients that in the beginning, so their expectations are that they're never going to have hair return, because in most cases it doesn't. But in some cases, you do get sparse regrowth that has to be occasionally retouched over time.
So what's the procedure like? Is it you come once, and how often does a patient come for this treatment?
Most treatments...
To ensure the permanent removal, the word permanent in aesthetics.
Most treatments consist of a series of treatments of anywhere from 3 to 8 treatments, depending on the texture of the hair and the thickness of the hair. So there's a series to get the initial reduction of the hair. And then there may be a period of several months or sometimes even years before the sparse growth returns.
So actually it doesn't kill the roots?
Yes, it does kill the roots, but sometimes the roots can regenerate. Yes.
That's what I was thinking. Well, do you do this on the legs too, of course?
Yes.
Any area that the hair is not wanted?
Correct.
Okay. How do you have a lot of people of the African descent responding to your treatment now?
Yes, quite a few.
Because I know you treat a lot of Caucasians.
Yes.
Yeah. Okay. And what is the type of result that they come out with?
Hair reduction. Basically, if you have hair on your legs or any other parts of your body that you'd rather not have to continue to shave all the time, then this is a very excellent alternative to having to shave on a daily or weekly basis.
Okay. So bye-bye to razors?
Bye-bye to razors.
Okay. Dr. Walker, we're going to take a little break and view some clips that will help explain some of the things you're explaining. And we'll be right back.
Thank you, Dr. Okeke.
So please stay tuned and don't go away.
Welcome to Piedmont Minor Emergency Clinic, where Dr. Maria Walker is the medical director. For over 20 years, Piedmont Minor Emergency Clinic and Piedmont Travel Clinic have been names you've known and trusted for your minor illness, injuries, and for full-service international travel inoculations. Our physicians and staff are proud to introduce to you Piedmont Cosmetic Laser Clinic, where we offer state-of-the-art cosmetic procedures for laser hair removal, facial wrinkle and acne reduction, blue spider veins in legs, and much more at affordable prices. We are open 7 days a week and conveniently located in the middle of Buckhead at 3108 Piedmont Road, Atlanta, Georgia, 30305. Our office telephone number is 404-237-1755. Our website is www.piedmontminor.com. Piedmont Minor Emergency Clinic is the name you've known and trusted.
The Law Office of Donald P. Edwards is proud to sponsor African Treasures, a program that celebrates the African continent, its people, its music, its past and its future. Wherever we are on the face of the earth, we are an African people.
We are bringing the treasures of Africa from all parts of the world straight to you.
Welcome to Atlanta, Miss Nigeria. We're so glad to have you here.
Thank you very much, Miss Nigeria Atlanta. I'm so glad to be here, and your city is so beautiful.
Yes, Atlanta is a very multicultural city with lots of African American businesses.
Well, talking about businesses, how do I get to do my nails, my hair, see a doctor or dentist or something?
Well, the Metro Ebony pages would be your answer. We have 2 editions, one that focuses on North Atlanta and one on South Atlanta, and it will tell you everything that you need to know.
Oh, really? Wow. Metro Ebony pages.
Yeah, Metro Ebony pages.
For more information on how to include your business in the Metro Ebony pages, you may call 404-209-8654. Welcome again to African Treasures. If you missed this show, please log on to our website. It's www.africantreasurestv.com. And you have opportunity to view some other shows that we've done since the inception of this program. Our focus today is laser hair removal or cosmetic laser treatment. And our guest is Maria Walker, MD. Welcome.
Thank you, Dr. Okeke.
Before we left to view some clips, we were talking about razors and bumps and stuff like that, but we never really got into it. So what do you have to, do you have more to tell us about shaving and the effect of razor as opposed to, or compared with the laser treatment?
Well, most people, when they hear cosmetic treatment, they think that it's only concerns females. Males in particular are very plagued by a condition called pseudofolliculitis barbae, or commonly called razor bumps or shaving bumps.
That's a lot of words.
Yes. African American males in particular have a very difficult time dealing with these because of our hair is very curly. It tends to grow under the skin when we shave very close to the skin, so you end up with bumps. This is one particular condition that's very amenable to laser treatment. Basically, you destroy the hair follicle, the root itself, so you don't have regrowth of hair, so then the bumps are eventually, they go away. So it's one treatment that's men are especially concerned with using cosmetic laser for.
How do you compare laser treatment with electrolysis?
Well, electricity, obviously, that's a form of energy that can be destructive to body tissues. Okay. Laser is a totally different form of energy. It's a light energy. The comparison between the two can be viewed as somewhat similar, but just an entirely different power that's being used on the skin. One thing about electrolysis is each hair has to be treated individually.
That's what I was thinking.
And that can be quite tedious when you're talking about removing an entire leg worth of hair or on your back or on your face.
You got to learn how to count.
Right. And so it's
But laser tedious. Can take just a group of hair
yes.
out at the same time.
Right.
Okay. But does electrolysis provide more reliable and permanent hair removal as opposed to
No, not really. I would say laser is probably more permanent than electrolysis, because electrolysis is also hair reduction rather than permanent removal, because with electrolysis sometimes the hair follicle does regenerate or the hair comes back thinner.
Right.
But it's a little bit laser gets a little bit more power to that hair follicle. So it's less likely to regrow.
Sorry about that. So for people who have facial hair that they don't like, or in their legs and some other areas of their body, there's hope.
Absolutely.
You don't have to walk around being shy or your self-esteem being low or things like that. You can get them treated.
Yes,
you can get
correct.
yourself treated and get all those hair removed.
That's correct.
And walk around with your head up high.
Yes,
well,
sir.
Dr. Walker, I thank you for providing this service, and I'm sure your number and your office will be on the screen so that people can call you. But what I want to move on to talk about is, it's not just hair removal. The the cosmetic laser treatment can also be used to treat veins that are popping out of your body.
Particularly the small spider veins or the surface veins. The laser that we use is not really good for the very large, deep, ropey veins that people call varicose veins.
Okay.
But this is more the superficial, broken veins that people don't like to see on their legs particularly ladies when they wear short pants or short skirts where they have the veins that may pop up behind their knee or on the lower part of their leg.
How about acne scars?
That's also another condition that's quite amenable to laser treatment.
Which means younger folks can really come
Yes.
for treatment. So it's not just for adults.
Right, teenagers, once they start with acne, because the laser can be used to stimulate the oil follicles in the skin as well, and cause them to become quite reduced so they don't have the breakouts.
Last time I came to your office and we were talking about this cosmetic laser treatment, you mentioned something about rejuvenating the individual. Okay, like
Skin rejuvenation.
Yeah.
Yeah, that's people who have had previous scars or who have rough patches or dry patches on their skin. The laser can be used to basically resurface and reshape the consistency of their skin.
Yeah. And what about wrinkles on the face?
Now, very deep wrinkles need to be treated with some other modality, but if you just have fine superficial wrinkles that you want to just smooth out, the laser can be used for that. Now, we also provide another treatment called Botox, which is an injectable form of medication that helps smooth out the deeper wrinkles.
Right.
But laser can be used for the more superficial wrinkles.
Is that a laser process also?
No, Botox is an injectable. Yes.
Okay. You provide that at your
Yes,
clinic?
we do.
Okay. Okay. Well, do you find this? It sounds so sophisticated. I'm concerned about the price. Is it affordable to a lot of people?
Well, it's quite affordable. Most people,
Or is it for rich folks?
No, it's not for rich folks. I think people spend a lot of money on taking care of their beauty. So it's comparable to most other cosmetic treatments that people go through. I mean, people spend a lot of money getting their hair done on a regular basis or getting their nails done. So it's in line with those. It's a little bit more expensive than that, but not a whole lot more expensive than the typical treatments that people do on a weekly basis.
Yeah. Is it covered by insurance?
No, unfortunately, insurance doesn't think your beauty is something that needs to be paid for.
But you have something that most people can afford, though.
Yes, absolutely.
And when they call your office, they can find out that.
Yes, that's correct.
All right. So we're going to take a little break and come back and find out more about the Piedmont Minor Emergency Clinic. Stay tuned. Welcome again to African Treasures. Our guest today is Maria Walker, MD, the Medical Director of the Piedmont Minor Emergency Clinic here in Metropolitan Atlanta. Welcome to the show.
Thank you, Dr. Okeke.
In our first two segments, we covered, we were looking into the kind of treatment that you get with cosmetic laser treatment and what it's used for and who gets it and how much and all that. But I want to move away from that a little bit because you do a little bit, your practice encompasses a little bit more than that.
Yes.
You also have two other arms of your business or of your practice, the Piedmont Travel Clinic. Can you tell us a little bit about that?
Well, the Piedmont Travel Clinic, we're one of the earliest travel clinics in Metro Atlanta. We were started in 1984. We provide services for people who are traveling outside of this country, who are going into areas that may require injectable vaccines to prevent diseases that might be encountered in some other countries that are not, native to this country. Particularly African countries, Asian countries may have more diseases that are not prevalent here that we need to be vaccinated for when we travel.
Okay. So how much needed is this service?
It's very needed. Actually, if you travel to some countries, you are not allowed to enter the country unless you have documentation that you've been vaccinated against certain diseases. So it's part of your travel documents, your passport and every immigration papers to enter certain countries.
Yeah. Okay. Because I'm from Africa, so whenever I go home, I have to take all this malaria tablets or shots and stuff like that. Is that what you're talking about?
Absolutely.
Okay. And are there countries that are more at risk?
Yes, every country has its own particular form of diseases that we have to vaccinate for. And at Piedmont Travel Clinic, it's real-time data that we're providing to the patient, the individual patient who's traveling, because that changes from time to time. Certain times of the year, certain diseases may be more prevalent than other times. So it depends on exactly what time of year the patient's traveling or the travelers will be entering that country, how long they're going to be staying, what types of things they're going to be doing. That determines exactly what types of treatment they need.
Yeah. What about the Piedmont Minor Emergency Clinic? Tell us a little bit about it. We'll have very, very short time.
Well, the Piedmont Minor Emergency Clinic, again, we've been in the Buckhead area since 1984, and we provide minor emergency treatment to anyone who walks in. It's not on an appointment basis. It's if you have a runny nose or a sore throat or a minor infection that you need treatment for.
And injuries, of course.
Injuries, of course. Right then and there, we treat them. Right. Frequently, you can't get in to see your personal physician when you cut your finger and you need stitches. So rather than going to the emergency room and having to sit there for a long period of time behind all the more major emergencies, you can come to Piedmont Minor Emergency and take care of your day-to-day needs.
One thing I found out about your practice in your office is that you have another office located in Snapfinger with Indicator.
Yes.
And have your main office on Piedmont Road.
Yes.
Your hours, you're open 7 days a week.
The Piedmont Minor Emergency Clinic is open 7 days a week, as well as the travel clinic.
Including after hours?
After hours.
That's a little bit unusual. It's like mainly a hospital, mini hospital kind of.
Not exactly.
Not
but
exactly.
I mean, it's open hours that allow people to do their regular activities, come by before work or after work, and get their needs taken care of.
Dr. Walker, I want to thank you very much for coming to our show. And we have a lot to talk about, but the time is limited. So maybe I'll ask you to come back next time.
Oh, thank you. I'd love to.
Oh, wow. Thank you for coming to the show, Dr. Walker. And we're going to bring this show to conclusion. Thank you for allowing us to come into your home. And remember to tune in next week, same time. Thank you.
For over 10 years now, the Metro Ebony Pages has been the only directory that caters to the minority communities in Metro Atlanta. For businesses trying to reach the minority communities, the Metro Ebony Pages is your vehicle. Individuals and families looking for services within the community, look first in the Ebony Pages. You may reach us at 404-209-8654.